So hello everyone, my name is Priya Patra and I am the Vice President Outreach of PMI Mumbai Chapter. And I'm your host for this session today. I will say hostess for this session today. And I also have with me our second anchor chapter, South Africa. And Pierre is representing South Africa chapter here. So Pierre, would you want to say hi to everyone?
Hi everyone, it's Pierre from PMI South Africa.
Yeah. I do also have Roshank from PMI Gujarat chapter. Roshank, would you want to say hi to everyone?
Hello everyone. Good morning, good afternoon, good evening.
And Arif from PMI Indonesia chapter as my co-host. Arif, please say
hi everyone.
Yeah. All right. So today we are starting our first session of PMI Chapter Exchange Season 2. And we are very excited. Yes, because we have two more chapters joining hands with us today. And first is PMI Gujarat chapter India and PMI Indonesia chapter. And along with them, all these logos that you see here are our supporting chapters or our partner chapters on this program. And these are all those chapters who have been with us since 2020. And we have lots of registrations today. And actually from 35 countries. Isn't that exciting and overwhelming? Yes, I think so. So let's move on. Yes. Please say hello to each other, Grushank, and if you could type in the Menti code for everyone to let us know from where they have joined in.
Yes, I'll be entering this into the chat now, and it will be there. Can everybody see this?
Yes, we can see it now. Yes. So it is www.menti.com and the code is right there. It is 8961 and 15. And let us know from which country you have joined in. And this is just to understand how and who is joining in this program today. So please go ahead and say hi to each other on the chat window. Please feel free to share your LinkedIn profile and go to menti.com and let us know from where you have joined in. 896115 www.menti.com. And as I said, we have participants from all across the globe in this event today, from Phoenix, United States, South Florida, New Zealand, and all countries and continents and time zones in between. So thank you everyone for this overwhelming and warm response to this initiative. Some working agreements, and if you could add, as you know, that we are seeking your feedback as well as if you're letting us know from where you've joined in through the menti.com, and that we are already doing 896115, and that's our if you have a question to our panelists, post it on the Q&A window, and that's our feedback link. Rishank, if you can paste the feedback link on the Q&A window, even that would help, or the chat window. You could scan the QR code. Yeah, you could scan the QR code, or you could just click the link to take the feedback anytime during the session. This meeting has been recorded, so if you are uncomfortable in any ways and you may choose not to attend, else you are welcome to continue. Everyone in this meeting is talking on their own behalf. We do not represent our organization in any way. It is all our personal views. So with this, we will start our season 2 of PMI Chapter Exchange program. And who other than Dr. Srini can lead us into season 2? A little bit about Srini. Srini needs no introduction. He is a regional managing director of Region 11, a huge supporter of this program. Thank you, Dr. Srini. He's a senior leader in the non-profit sector and previously in global management, CEO and entrepreneur with lots of experience, 33 years to be precise, and in the intersection of professional services, technology, and leadership development. With this, I will hand over this virtual stage to you, Srini, for opening of season 2 of this program.
Thank you, Priya, and welcome everyone. I just want to correct one small fact from Priya's introduction of me. I am only 33 years old. So I just wanted to make that clear to everybody. It is really a privilege for me to be part of this session because not only am I a fan of Chapter Xchange, I happen to think this is one of the most innovative programs that we have within PMI. And this is a wonderful example of what we as PMI stand for as a global organization. And it's right in front of us. We don't have to travel far. So I am delighted that all of you have come together. I welcome the Indonesia chapter. I welcome the Gujarat chapter. Gujarat became the newest member of the Region 11 family. And so it's all the more exciting that they're now part of the Chapter Xchange. And I am absolutely delighted to be the only person on this call who is actually speaking for PMI. So I'm not speaking for myself, I'm speaking for PMI to tell you how proud we are of this program and of all of you for taking part and actually living the spirit of our global character. I just want to take a couple of minutes to underscore a key topic, a key theme that the Chapter Xchange has already taken up, which is future ready. How to be future ready. This is on all of our minds, as you can imagine, and especially after the devastation of COVID. How can we be ready for the future? Fortunately, as you know, PMI has been thinking about this as well, even before COVID. And we said, we need to find a way to create a future ready project manager profile. And we said, we need to have a project manager who has the skills and capabilities to be able to handle the complexities of today and tomorrow. I think you will all agree that the level of complexity in the projects and programs that you're part of have gone up exponentially, especially after COVID. And guess what? They're not going to get any less complex. They're probably going to get even more complex as we go forward. So PMI said, let's look ahead. And that's the 4.0 strategy that I'm sure most of you have had a chance to touch and feel. The 4.0 strategy, in my mind, really is all about one key change, one key difference in the way we all look at the world. And that is, we said, we want to address our community as change makers, not as project managers, not as program managers, not as members of a PMO and EPMO, which are the traditional definitions. We said we want to embrace anybody in an organization that is involved in some type of a change program. And if you stop and think about it, it's not just words. It's a very profound change in which we are looking at supporting and helping skill a whole lot more of people within the organizations that you're part of than just the traditional PMO or EPMO. And we said these change makers really are, in their own way, managing bits and pieces of projects. They may not have the designation, they may not have the title, but nevertheless, they're responsible for making change happen. And we said, we want to find a way to support this larger community. So there were 4 pieces that you already know. I'm not going to harp on it, but expand our reach, partner with more associations, help focus on B2B, and also think about the social impact that we're having. This is not new. You already have been doing this for a long time. But the key thing is PMI said, we will also provide tools, methods, content, bodies of knowledge, training, and certification to help support this larger community of change managers. So not just the usual suspects of a PMP or a PGMP or a PFMP. We're saying now the futuristic, well-rounded project manager, change maker needs things like business agility skills, hence discipline agile, needs ability to collaborate and make things happen, especially with remote teams, with distributed teams, hence the power skills, design thinking, and so on, wicked problem solving. We said change makers, including all of us on this call, have to be better prepared to be able to lead organizational transformations, digital transformations, hence courses around organizational transformation, certifications there. And last but not least, we said this change maker community also could benefit from being skilled in low code, no code, which is, as you know, the ability to bring program development closer to the business without having to always depend on the IT department. So hence citizen development. So that is really the logic behind all of this. I just wanted to say that your theme of Future Ready matches our purpose of trying to find a way to skill a much larger audience and to reskill many of us on this call as well, reskill or upskill. And I know today's topic is healthcare, which is probably the hottest topic you can think of, and it's the right topic for you to be talking about. I know you have a very distinguished panel, but I'm just thinking to myself, imagine if one of us were actually managing, say, the vaccination program nationally in India to vaccinate 1.3 billion people. Imagine the kind of skills you would need. That's future ready. That's future ready. And I know the panel is very well equipped to talk about it. I know for a fact Dr. Deepa Bide has been living and breathing this along with the other panelists. So I will let you go and listen to the people you came here to listen, and have a wonderful, wonderful session. And please keep this spirit of partnership and friendship alive. Thank you.
Thank you, Dr. Srini. Yes, we all need to be future ready. And I love this, quote from PMI, which says that we are all change makers and they are helping and supporting change makers. And of course, we really require their support right now. And we are looking forward to the future. We are not stuck here in this present anymore. And with this, thank you very much for those words of wisdom from you, Dr. Srini. And we will move on to the next part of our segment. I heard people were saying that the Menti was not working, so it should be working now. Please take the poll now. Sorry about that. Yes, I wanted to look back on season 1 a little. And that is why, I think I have the slide made, which I always present in all of the chapter exchange events. But today we're going to look back and see what happened in season 1. Yes, it was collaboration again. And we had 10 chapters who were participating in this program, plus many supporting chapters as well. And our vision is to evangelize cross-chapter collaboration and encourage cultural diversity. We started with our collaboration in May 2020, and 2020 saw 10 chapters, as I said, and many more supporting chapters. We co-created 7 events ranging topics which would make us future ready, like key skills required for project managers in COVID and beyond, plus from agile frameworks to whatever works to making work from home work for us, to name a few. We have thousands of participants from 30 plus countries joining us in these programs. 2020 was just the beginning. Yes, it was just the beginning of an exciting journey, as I would say, as a community. And we did build up on each other's expertise. We shared good practices within ourselves, as well as we were approached by many other chapters who wanted to initiate such similar collaboration in their regions. And we were happy to share what we learned. And yes, we grew, but not in numbers only, but in a sphere of influence through diversity and equity of thoughts. And that is why you will notice that although we have just 12 chapters, but we have participations from around 35 countries all across the globe. Because we truly believe diverse connections leads to innovative solutions. And as I said, there are 16 chapters right now on this platform, and it is growing. And I'm happy to see that we had planned for 10 chapters in 2021, and already 6 are there on this platform. So thank you everyone for your kind support and overwhelming response. Now I will hand over to Dr. Sanjay Buddh, the president of PMI Gujarat chapter, our newest partner in the program, for a foreword on this program and the event.
First of all, thank you very much, the PMI Chapter Exchange programs office bearers, to inviting us and allowing us to join in this collaborative platform. I will just try to take you the brief journey about the PMI Gujarat chapter. We have been granted a PMI potential chapter in the month of April 2020. The reasons being, as all of you know, the PMI Gujarat is one of the prospering state economically as far as the infrastructure wise actually. And we had almost 700 members actually associated with PMI and the Mumbai chapter in the different capacity. And the PMI, everyone feels that Region 11 leadership Gujarat is a potential, and why can't we motivate them to form a chapter actually, which will help to provide a diversified and focused services to the membership actually. By taking those ground rules in the mind actually, we initiated the movement. And then in July 2020, we have been successfully converted into a full-fledged chapter actually. So far, we have 107 memberships on the board actually, against our target of 100 members before the March 2021 actually. Within the less than 9 months, we could able to mobilize the 107 members. We could arrange 9 webinars, which has benefited more than 600 attendees and community. We are also conducting various certifications programs actually for the benefit of the memberships and the certification aspirant actually before the ATP programs full-fledgedly comes in actually. Our vision, as all of you know, we are a PMI component, so we need to be stick to the PMI rules, guidelines, and frameworks actually. But how we can achieve those actually? So we, as a PMI Gujarat chapter, we feel that we should be agile, adaptable, and collaborative in our approach actually. And that is the only mechanism actually. That is the only way where our volunteers and our membership can expose to the global world actually. Because all of us know actually, the pandemic has also changed many things actually. PMI is also changing many practices and many processes also across the world actually. ATP program is also comes in actually. So how we can make our chapter more agile, adaptable, and collaborative. So the only mechanisms and only framework we can collaborate with the other chapter actually, and that is why it has motivated us actually. We feel that we keep on getting the emails from the Priya related to the chapter exchange programs. Then there were initial interactions between our VP programs, Dr. Rusang Puch and Priya. And then he placed a proposal. We have been invited to join actually because we are new one. So our board has immediately readily agreed and consented to align with the PMI Chapter Exchange program actually, which has given a great opportunity across the world and our memberships to expose and exchange the idea. See, cultural exchange is right from the beginning actually we are being following actually, practices actually. We are many times in students, any other delegations actually goes to the other countries and they understand the various cultures and the various rituals of the other country. The sharing and collaborating and exchanging the project management related idea across the globe will definitely enhance the knowledge and the skills and the exposure of our memberships and everything actually. And that is why we have been joined and we have aligned this actually right from the day one of the initial stage of the chapter. We are sincerely thankful from the bottom of the life from on behalf of our memberships in our board to express our sincere gratitude to Priya and all the chapter exchange program team actually steering committee for allowing us and giving us opportunity to join. And we are assuring you that definitely we will try to make a difference and we will try to add the value in the chapter exchange program actually. We ensure that our motto and the basic purpose of launching this chapter exchange program will fulfill. Our membership will get the value added services also, and we will be definitely progressing in a collaborative manner actually. Once again, thank you very much for giving us an opportunity to present before this kind of esteemed audience actually, and thank you very much again.
Thank you, Dr. Bush. And with this, I will hand over the stage to Aline Veronica, the president of Indonesia chapter, to say a few words.
Okay, thank you, Priya. Good morning, afternoon, evening to everyone. From Jakarta, Indonesia, I would like to wish you all a warm welcome. It's almost bedtime here in Jakarta and it's Friday night. And what a way to start the weekend learning from the subject matter expert. Every cloud has a silver lining despite the long periods of quarantine and the tough travel restriction imposed everywhere. People have found ways of connecting and collaborating. The Indonesia chapter over the past year also has connected to so many people, subject matter experts, company, and some have become our supporters. These pandemic time connections have allowed us to share stories, increase our professional capacity, and even lead to new jobs or business opportunities. Okay, a little bit about the Indonesia chapter. We are based in Jakarta, the capital. We are now entering our 25th year and we have around 700 members. We established 3 branches in Bandung, Surabaya, and Jakarta. Some of our members are joining this event today, and I'm glad that we have facilitated our members to connect, gain some insight from a global event. This chapter exchange program has come a long way in such a short time span, starting with 2 chapters and now 10 chapters to deliver knowledge, experience to you through collaborations. This event today is about project management in healthcare. And if you are wondering what is so different about managing projects in the healthcare industry, today you will get the answer from the panel of speakers who come from this very industry. The diversity that I see in this program from the panel speakers, the numbers of participants from more than 30 countries is amazing. Please take advantage of this platform to share, connect, and interact with speakers. fellow volunteers, and not just during the event, but also after the event. Please take advantage of this platform to build relationship or to contemplate a new learning opportunity. On behalf of the Indonesia chapter, thank you so much to the volunteers at the PMI Chapter Exchange program, Priya and the team, and thank you for inviting us on board of the program. We will extend our full support to the success of these collaboration events. And I hope all the speakers and the participants will have a great session. And I hope that we can all soon come back closer to normalcy, where we can fly and meet each other in person. But in the meantime, please take care and have a great weekend. And thank you.
Thank you, Alina. And that was great, inspiring words of wisdom. And really, we do look forward to face-to-face interaction soon. But as of now, we are continuing with this virtual platform. Actually, this virtual platform has given us an immense opportunity to connect with so many people across the globe. So that is a positive thing that I'm taking from here. Just as you said, every cloud has a silver lining. All right, so with this, Arif, I'm going to share the stage. I'm going to hand over the stage to you so that you can take us through the discussion that we are looking forward to, project management in healthcare.
Thank you so much, Priya, and hello everyone. As introduced earlier, my name is Arif. I'm from Indonesia and I will be moderating today's discussion. Shortly, I will be introducing our panel of speakers, and then I'll start the discussions with somewhat an overview of the situation about healthcare and project management. And then as we go on, we will go a little bit deeper into the specific topics. We welcome the audience to ask questions and comment on what has been discussed with the panel. So please do send us your comments, your questions through the chat box, and we'll try to get through as many as possible within the allowed times. So let's get right to it. Allow me to introduce our distinguished panel of speakers today. I will start with Bruce Gay, who has had over 2 decades of experience on managing large complex programs and customer relationships across multiple industries. He is currently holding a role in a large hospital system. He manages a PMO for the organization's innovation center. Bruce's public speaking experience includes presenting both regional and international professional conferences, such as the PMI Global Conference in Chicago, Los Angeles, and Philadelphia, and the PMI EMEA Congress in Dublin, Ireland. Bruce is also an active volunteer with PMI Pittsburgh chapter and is the director of corporate sponsorship. Bruce publishes a popular monthly newsletter on project management and related topics, and you can sign up for regular access. I'll share the link in the chat box soon. brucegay.com/sign up. I'm actually signed up for that newsletter as well, so it's very good. So hi Bruce, how are you? How's everything?
Doing very well, Arif. Thank you for having me to participate in this panel today.
Very good to see you. Very good to have you. The next panelist we have is Dr. Deepa Bide, who has over 20 years of professional experience where she has blended medical practice and research with IT and project management. She juggles between consulting, training, and operations. She's proficient in clinical medicine, project management, and healthcare information technology. With a gold medalist physician and a project manager blend, she brings a unique combination to healthcare and project management. Her paper on patient care, a project management perspective, is a widely acclaimed one and having received global recognition. She holds MBBS and DCH degrees with specialization in neonatology. She has been a PMI volunteer since 2007, She's a global volunteer also, and currently serves as a co-chair in the PMI's Ethics Insight team. She has participated as speaker and panelist in a wide range of national and international conferences around project management, healthcare, and most recently the COVID-19 project management. Deepa lives in Hyderabad, Telangana, and enjoys music, cooking, and most importantly, travel. Hello, good evening, Dr. Deepa. It's good to have you with us today. I think you are still muted.
It's my pleasure to. Good morning,
Okay.
good evening. It's my pleasure to. So thank you. And looking forward to the session.
Very good. The next speaker I would like to introduce is Giovanni Gupta, who is a project management evangelist and a practicing PMO and project manager with an extensive track record of successful hands-on project management in Fortune 500 companies in government and non-profit sectors, particularly in healthcare industry. She's currently the PMI president for South Florida, and she holds multiple certifications in project management, the PMP, the CSM, SAFE, LSSMB, DA, Agile, Hybrid, Project Pro, and to name a few. Right? She has an MBA in operations and marketing, a postgraduate diploma in computer applications, and a bachelor's in medicine. Giovanni is based in Miami, and in addition to currently leading a healthcare startup, she actively works with PMO Project 9, a Miami-based not-for-profit, and she has served in an advisory panel for Broward College and Kaiser University of Florida. Welcome, Giovanni. How are you?
I'm good, Arif. Thanks for the great introduction, and thanks for having me today. Thank you, guys.
Thank you very much. Very good to have you here with us. And the next panelist is Mr. Michael Reinders, who grew up and completed high school in Johannesburg, South Africa. He relocated with his parents to the Netherlands in 1987 and studied chemical engineering from University of Bath in the United Kingdom. He moved back to Cape Town and completed an MSc degree in bioprocess engineering from University of Cape Town in 1995. And after working for 4 years as a chemical and bioprocess engineer, Michael switched careers and moved into IT project management in 1999 for an international IT company. He joined Mediclinic Southern Africa in 2004 to help set up an IT project support office, or the PSO, which then matured into an IT PMO. And the next step in the PMO journey came in 2013, where an enterprise PMO was created, or the ePMO. The portfolio of the ePMO consists of various ICT implementations, business processes, improvement projects, business acquisitions, and integrations. Michael enjoys spending time outdoors with his family, and he is a keen club cricketer and a cricket administrator for the West Province Cricket Association. Hi, Michael. How are you?
Good afternoon, Arif. Thank you very much for that kind introduction, and thank you very much for the opportunity. I'm really looking forward to the discussion today.
Fantastic. So excellent. So now let us begin our panel discussion. So having gone through 2020, which is a very difficult year for everyone, some can only imagine, the disruption that happens in hospitals, clinics, other medical facilities. How did the facilities adapt and cope with this explosion of patients with a new illness, and now with the proliferation of vaccines, as mentioned by Dr. Srini earlier? How was this managed and is still being managed now? How did they get distributed? The way governments and companies adapted to the COVID-19 is beyond clinical complexities. It requires a coordinated effort. It requires collaboration. It requires a technology infrastructure that enables remote teams to work together. And it requires dashboards that display all the useful informations with accurate data that sharpens the quality of the decision making. And all of these require projects. So I will start with Giovanni. So what is so unique, Giovanni, or what is so different about managing projects in the healthcare industry? If you could please unmute your line.
I apologize. Okay. Thank you, Arif. First of all, I want to say and pay my thanks to Priya, Mumbai chapter, and all the chapters that are participating in this exchange program, and all the attendees that have joined us today. Now, to your question, what is unique about managing projects in healthcare? Healthcare is a very wide industry, and there are many specific subdomains in it, like hospitals, pharmacy, health insurance, home health, telemedicine, diagnostics, urgent care, and there are many more, just to name a few. There are operational projects like setting up immunization services in a health center, and there are projects for automation of pharmacy prescription intake process, etc. in technology domain. So all are very different. Now, the question is, what's unique? The unique thing in healthcare system projects is everyone and anyone involved is helping to save lives of people directly or indirectly. I would love to narrate a brief story here. In US Congress on May 25, 1961, President John F. Kennedy announced his goal of putting a man on the moon by the end of the decade, right? So the story goes like this. President announced it in the Congress. Then he happened to visit NASA headquarters for the first time in 1961. And while touring the facility, he introduced himself to a janitor who was mopping the floor, cleaning the floor. And President asked to the janitor, right? He asked, what did he do at NASA? Janitor replied, I am helping to put a man on the moon. So the same way I would say about healthcare projects, the most unique thing is that everyone involved or everyone working on these projects is helping to save lives of the people, which is most important and critical and valuable to humanity. Now, talking about what's different for healthcare projects than other industry domain projects, I would say it's highly regulated. Almost every aspect of healthcare delivery across the world, I would say, is regulated. The creation, manufacture, sale, use of drugs, the diagnostic tests, medical devices, all are regulated by Food and Drug Administration here in US. There is CDC. We all wait for the guidelines. We follow the guidelines. There is a lot for compliance like HIPAA in USA. Not the same degree of regulation is being exercised in other industries. They are, but not to the same level, I would say. Healthcare industry is a cottage industry and highly prone to risks. I agree that every industry is prone to risk, but the impact on healthcare is a little different. It's on the lives of the people. And a very small change or miss in execution of the projects, or even we say operation activities, it can cause threat or to reveal the information or like impact on their diagnosis, prescriptions, insurance, etc., and ultimately to the lives of the people. And this is very critical and very unique to the healthcare domain industry. Thank you, Arif.
Thank you so much, Giovanni. Some very good highlights there, right? Helping and contribute to save people's lives. It's a highly regulated industry. It is prone to risk, and also we are dealing with some very seriously confidential data of the patient. I would like to get your opinion, Bruce, if you could, right, to add, from a skill set standpoint, how does project management skills contribute to the industry? And I see, since you are also coming from a technology background, how does the technology tie into this project management in healthcare?
Thanks, Arif. And I want to build a little bit on what Giovanni had said. So the industry is risk averse, and it is cottage, and it is highly regulated. It is also behind other industries such as finance, technology, government, in the use of technology, in the use of interoperability of data. I think here in North America, we still struggle with our systems to interop with each other. And then one thing that I'm continuing to work on within my organization, and I've seen in other healthcare systems in North America, is an underappreciation for the project management skill set. There's a lot of individuals within hospital systems, within insurance systems, who are doing project management, but they haven't been properly trained on it, or they have come up through the ranks as a clinical or operational specialist who are then managing projects. And so I think there's a great opportunity for project managers who are willing to look for the opportunities to jump into the healthcare field. Now, knowing there is a very large and very specific vocabulary. So there is a learning curve for individuals who move from one industry to the other. And there's also a bit of a hierarchical nature of healthcare too. So as a project manager, there is a need to understand how you operate within the environment, understanding who has the levers of power, who controls how things move, and it's very interesting. So there's lots of challenges, but I say there's nothing but opportunity for project managers and change makers to move in and help healthcare grow into the what we need in the next century post this pandemic. So thank you, Arif.
Do you see, Bruce, just a follow-up, do you see that it is now somewhat systematic in the way healthcare projects are being managed?
It depends on the maturity and the size of the organization. Regional healthcare that say is province level may have some centralized ability to manage projects, to do portfolio management, to manage their investments within their system. But individual hospitals, here in the US, we have lots of smaller hospitals that are very localized, and they do not have that type of management of maturity. They lean very heavily on vendors. They lean on the outside vendors who come in and help them solve those problems. But then what happens is at the end of a project, the know-how and the ability to manage that complexity, it does not stay within the organization, it leaves. So, and then national systems, they definitely have that ability. NHS in the United Kingdom has very, very mature structure and way to manage its investments and portfolio.
Very good, very good. Thank you so much, Bruce. So now I would like to, by the way, for the attendees, if you have any questions, again, please feel free to ask, and we will go through them as we go. I would now like to quote Dr. David Hilson, who is known as the risk doctor, right? He's a researcher, he's a project practitioner, and he mentioned that when it comes to risk, many people refer to the COVID-19 as the black swan that surprised everyone. but according to Dr. Hilson, he says that the human race has gotten used to pandemics. You know, we've had pandemics for many, many centuries now. And in fact, the black swan that no one expected in 2020 was actually the global lockdown, right? And how countries reacted to contain the spread of this virus. Dr. Deepa, as a medical practitioner and also somebody who has also been involved in the way countries responded to this, do you agree with this, that we as a collective society are used to pandemics, and what were the main challenges or what was different with this one, if any?
Thanks, Arif. That's a very good question, and probably on everyone's mind whether it was a black swan event. And to me, the black swan event is something that is highly improbable, but clearly the pandemic was not a black swan event. It, in fact, the right metaphor for this, it is probably interesting to know, would be a gray rhino. And this was coined after the Greek financial crisis. And it would say that it was coming. It was something which is obvious, probably neglected. Now, if you see the history of pandemics, it's not new that this pandemic is something that has come right on our face, but it has been from millions of years. If you take the Spanish flu, and then you have seen the SARS and the MERS. Even if you take the latest as HIV, as if you take, it's one of the pandemics, and now it is almost an endemic. So the reality is that you start a particular disease, it comes as an outbreak. You diagnose that there is something abnormal, and that's what WHO did in the January of 2020, that there is a different type of cluster pneumonia is what they called. And later on, it moves into a state where it can go either continue as a pandemic, it continues an endemic, or it goes into a pandemic stage. Now, I believe that the COVID-19 is not a black swan event. It was coming. It was, for example, the Global Preparedness Committee had, in a way, mentioned that there is a risk to the whole world. And that report had come out. For example, even way back in 1979, WHO had announced that the world is at threat for many pandemics, and no country is immune. In multiple influenza pandemics have swept the world. So I feel it was coming. It is just that the alarm that came in, and then the way it swept. And today we are in a grip of the pandemic, which is obviously not 112 million people involved with 2 million deaths, more than that. So I feel it is still a concern. Now, there are 4 or 5 things which I feel from a medical standpoint, which are very unique to this. First is the healthcare capacity. Now, given that this is a pandemic sweeping the world, there is clearly a scarcity of the healthcare capacity that is creating a concern, and the world over people are reacting in terms of how do we do that. So that's the concern number 1. The concern number 2 is about the whole model of the healthcare and redesigning the model. So today, where you have an interaction between a physician and a patient, and that's an in-person, and today when this particular disease is so highly contagious, we just need to redesign probably the interaction, probably the space, probably the infrastructure. The third is the financial ability, the financial crisis that this has thrown. For example, all of us know that all the elective surgeries have been postponed. But does that solve the problem? No, probably no. And hospitals are declaring bankruptcy because they don't have liquid assets. And the last and the final point would be retraining of the staff. It requires such a huge amount of retraining. And like my colleagues said, that it's a very unique, you are trying to save a life of a patient. And that training to save a life of a patient is very unique. So these would be my 4 points for the questions.
Thank you very much, Dr. Deepa Bide. And I think there is one thing that that last point that you touched about, the retraining, which is basically a competency building for organizations. Michael, do you see that this pandemic and all of this lockdown and how medical facilities reacted, how much of a challenge was it with regard to competency building and how you guys had to adapt to what is happening?
Yeah, that certainly was a challenge. You know, your traditional ways of working within a matter of weeks were changed. Initially, you worked with project teams where you would have meetings in a meeting room around the same table, around the same whiteboard, around the same screen. And now suddenly you were thrust into a position where actually nobody was allowed to be together. So it's a little bit of an oxymoron, because projects are about bringing people together, getting people to around the same table to see the same deliverable that needs to be done. And now within a matter of weeks, we were told that you can't be together. Actually, for the greater good of humankind, you actually need to stay apart. So it was a huge challenge from that perspective, certainly from the stakeholder management perspective and managing those stakeholder relationships. I'm sure we've all experienced the benefit of being in a meeting with somebody face to face, being able to read the body language and being able to hear the tone of the voice more clearly. Suddenly those meetings were now taking place without being in the same physical room. And that required a little bit of a skills development for the project management team, and certainly our approach in terms of the enterprise project office work that we did here. I think the other thing that was a big impact is that the type of project suddenly changed. Our project portfolio, which had multiple complex rollout projects to the hospitals, suddenly changed to a quick delivery, a short rollout, a short turnaround team. And that required a significant adjustment in terms of the competency and the tools as well that the project management team needed to use. And that certainly is one of the key lessons that we've learned out of our response as to how we would manage the project in a healthcare environment. But I don't think it's specific to the healthcare environment. I'm sure it's the same for all industries and project management around the world. Thank you, Ari.
Thank you, Michael. Just a follow up to that, right? I mean, when it comes to PMOs in your EPMOs, you know that there is now the hybrid model of working after the agile came, and prior to that, the waterfall. Do all of these matter when you are, or as you are adapting to these changes, and what is the take on your EPMO on this?
Yes, I think that's a very good question. I mean, we had a very traditional, the bedrock of projects and project management is the governance. So we had a very traditional approach where we at first, very similar to a waterfall approach, understand what needs to be done, do a thorough planning exercise, maybe do a proof of concept, and then a pilot at a few of the hospital sites before we go on a full rollout. And some of those projects would take, 18 months, 2 years to actually get geographically around the country to all of the 52 sites. Now we needed to make decisions were made quickly, and we needed to adapt. So the word I use, and I heard it used earlier as well, is agility. The ability to display agility in terms of your project management methodology and the approaches that you use was key. So we had to adapt. There was no longer a full project initiation document that went through iterations of approval. We needed to pull together a scope of work that could be presented within one day for a decision and then implement against that scope of work. So certainly agility is a key thing. And I'll just use a cricket analogy. What the pandemic did to our methodology is it turned the test match into a T20. Thanks, Arif.
Thank you, Michael. Bruce, do you have anything to add to that when it comes to, adapting to methodologies, and do people even talk about it, or is it, is it as we've had before in the previous section, going from, frameworks to whatever works, right?
Again, I want to take what Michael said, and I think he mentioned something very importantly, that quite quickly in March and April of last year, projects that had long time frames were slowed down or paused, and very quickly we had to react to many additional new needs that were required of us within our hospital system. I work within an innovation office, so a lot of what we have is already in a Scrum or Kanban, but we have a very large enterprise PMO, and they were very much the traditional methods, similar to how Michael described. And they did wonderful. They turned around with some very quick projects within probably 60 days. And if I was to step back and say, how would I describe these? These were things that were urgently needed for when the pandemic hit. Things like contact tracing around employees, contact tracing for individuals who come in and out of our hospital sites, knowing where our medical supplies and PPE. We had anquedated systems for that type of inventory. And as you mentioned, Arif, that data needed to be bubbled up into these dashboards. So a lot of the work in that period were, how do we present the information in a very fast way to our leadership? Something that was done actually by paper before. So that was, I think, if I was to step back and say, what did we do? We did a lot of digitization projects within my hospital system during that period in March and April of last year. So yeah, it was very much just get it done, get it out the door, get the value to our stakeholders and leadership that they needed.
Thanks a lot, Bruce. Okay, so now I would like to again slightly come back to the way we manage this change when it comes to competency, right? Giovanni, so what do you think, or how does the healthcare system or the healthcare industry build competency to manage projects? I know that earlier Michael had mentioned that it relies, heavily on the maturity of the organizations. But what then would be the ideal case or the proposed case to build competency when it comes to healthcare projects?
Right. So I would say the focus is not only to change the way how organizations build competency to manage projects, but it shifted the focus on certain competencies to an extremely high level. Events such as like COVID-19, this global pandemic, require healthcare organizations to develop greater competencies and skills in risk management, quality management, virtual collaboration, and procurement management. I would specifically highlight, and I'll give an example. So these are the specific areas, because I was managing PMO for a healthcare company in this COVID is still there, but until December, and the whole organization moved to work from home pattern, typically starting with a hybrid pattern. And as Bruce mentioned, a lot of new projects, and Michael mentioned new projects came in, and the existing projects slowed down. So when we are talking of competencies, the focus shifted. In PMOs, generally, we are aligned with operational teams for change management and trainings, etc., during just execution phase or primarily execution phase. But now, plugging in the operational area becomes critical even in the beginning of the projects and during planning phases. Reporting requirements increased multifold. As I just heard reports about contact tracing. So similarly, multiple reports to capture and understand impact of COVID on this. Typically, executive team or sponsors, they prioritize projects and then they leave it to project manager for further planning and execution. But now it's a little bit different. There's a change in the way we are building the competency because a lot more support from top management, top leadership is required. And not only this, I just mentioned about procurements, and I think that was also changed, or the way we were working, that was upgraded, more scrutiny in the procurement projects. And I'll give you just an example. In this COVID-19 time now, the need for personal protective equipments that increased multifold because I work in a healthcare industry. We work with clinicians. They are going to members' a home for helping them out, for providing services. And in this situation of COVID, several new projects were initiated by clinical stakeholders. We managed procurement projects to obtain PPE, this personal protective equipment, for clinicians who are directly interacting with members, patients, performing greater and deeper scrutiny of supply chains. So that was not limited to immediate vendors, but the vendors, like multiple layers. So projects and phases currently in initiation or planning, we reviewed them because now there were additional steps involved. So schedule was impacted. So the competency, the focus was primarily on managing risks, managing procurements with more service level agreements and more participation from attorneys and virtual collaboration. So many new projects to enable virtual collaboration, to help people so that they can stay working and they can keep serving our customers staying at home. That started. So I think the shift was, the emphasis was to build on procurements. In my experience in the healthcare domain I'm working in, and technology enablement to support work from home culture, virtual collaboration, as well as high focus on risk management.
Thank you very much, Shivani. So, Dr. Deepa, so what Shivani mentioned here is very challenging, right? I mean, shifting the focus and then getting additional layers of competencies such as procurement, managing procurements, and then technology enablement, and so on. This requires mainly a stakeholders buy-in, most, first and foremost, right? So do you have anything to add to that in terms of, how healthcare organizations can build these additional required competencies, and how do you get the stakeholders buy-in? And this is in line with one of the questions that was asked by the audience. How, for project managers, we just execute, right? But then these barriers will come if there is any misalignment from the stakeholders.
Absolutely. I think a very valid point Shivani made, and the emphasis, the way it has shifted, has in fact turned our focus as clinicians, as people who are frontliners, into really understanding what's the goal of what we are working for. So for example, if we are in the hospital, how are we managing our critical care units? The focus would have been in managing the routine work as well as some of the elective surgeries, the emergency surgeries. Today, I think the focus has shifted on 4 or 5 things. And I would say that all the stakeholders who are from the healthcare industry and allied are pretty much bought into this, because the reality is that we have to save the world. We have to be acting in sync or in synergy what is with the objectives. So first thing I would say is about shifting of the focus, just not necessarily from a primary or a tertiary care hospital, but even to a primary or field hospitals. So that is one way of you direct or you change, you give a better and a wider scope of clinical care. The second thing, like we said, is about what would I say, health of the healthcare workers itself, because the frontliners themselves are at a risk of contracting the disease, their mental, physical, and their emotional health. That is another thing. So obviously that takes in, and the stakeholders are perfectly bought into that. The third thing which I would say is the shift into the telemedicine part. Not that the whole world was ever into telemedicine was hardly 5%. And even from the reimbursement capabilities, the reimbursement for televisit wasn't as much. Today, if you see, there is a huge jump, more than 70% of the televisits are being reimbursed. The reason is that everybody is reacting and now proactively trying to understand how is it that you can minimize the contact and still ensure that the healthcare is provided in a timely manner, in a relevant manner. Now, for this, if you are asking how do we look at the stakeholders, who are the stakeholders? Actually, the key stakeholders are the patients, the physicians, the hospital staff, the clinical, the providers, the patients, and the pharmacies or the insurance companies, the procurement companies, and everybody today is so much in sync for ensuring that this value chain of the patient, which has now shifted, is going streamlined. It is seamless. And as a clinician, I do see that it is not going to come to an end, because now you see that parallelly, 2 or 3 folks would take off. One thing is the parallel vaccination drive. So there is another chain or clinical chain of events where again you have another group of stakeholders, and they are in sync because this is a logical next step for the pandemic. So we see that. The second point is about the growth and the stay of telemedicine. Is that competency around the technology, like my colleagues have mentioned, is that going to stay? Is that going to increase? We don't know. The third thing is about this whole governance structure. How do you pivot the governance structure to understand how is the patient doing? Because at the end of the day, the clinicians want
Sorry,
to know.
Dr. Deepa, just sorry to interrupt, but for those who may not be familiar, right, can you just elaborate very quickly on what is meant by telemedicine?
Telemedicine is where you take the consult and you have interaction between the patient and the provider through without a face-to-face contact by using any form of a technology. So it could be a mobile technology, just like this this webinar that is happening. It could be any face-to-face technology. So I do see that the competencies have shifted. The stakeholders have bought in because that is the need of the hour. I do not see anybody who is against this in principle. And third thing is the healthcare by I mean the frontliners are pretty much aligned and driving this force to its logical next steps.
Okay, thank you very much, Giovanni and Dr. Deepa. Bruce, we have a question from the audience. So there is a project which is a combination of infrastructure and the software deployment that goes with it, right? So what is, in your opinion, and it can be, because this is maybe healthcare related, do you see projects like this being rolled out over the past year? And what would be the best methodology? Because infrastructure is usually, connected to waterfall, whereas software deployment or development is agile. So how do teams who are involved in projects, or how do organizations that want to execute projects, what approach should they take? If you could please unmute, Bruce.
These types of programs we see all the time. Something where there's both an infrastructure change, some sort of interoperability between systems, as well as the pure software development of new applications. And so I think you explained it very well. We're going to use a mixture of methodologies, and it depends on what is familiar to the people within those teams and familiar for the organization. piggybacking on what Michael and Dr. Bita said, we did a lot of really fast projects to get in place last year. And I think that the software teams would use some level of more agile work. But when you start to do a rollout, you're going to need to have a much more structured methodology. I wouldn't call it waterfall. I would just say that it needs to be large. It needs to include change management. And because we're dealing with how people do their work. And when you roll out new IT systems within a healthcare environment, you are needing to work with individuals who are providing care and have them learn the new ways of doing work. So it's the short answer is it's really going to be a mix. There's no one magic methodology that can be applied across the board.
Thanks, Bruce. And Michael, do you have anything to add with that? Considering that you've been in the, you've worked with the same organization for 16 years, so it must have been, you've seen how the approaches evolve from how it was back then to how it is now. I mean, do these changes occur in your organization? And what do you think? Do you have anything to add to what Bruce said?
So it's a very good question, because I mean, in our organization, we build hospitals. So we've got a project management competency that manages the building and upgrading and maintenance of hospitals. And then our EPMO focuses more on the business and ICT projects. So you often do get the merging of those two. So a new hospital infrastructure project, which has got a very traditional approach, it involves bringing together the contractors that build the hospital, and then you've got to kit it out, and you've got to get technology into the hospital. So you actually find that those two worlds merge, but you have to change the way you work together, because if you try and implement a technology project in the same way that you build a hospital project, a building of a hospital, you're not going to get to, you're not going to get to the same answer. So it is a very tricky situation. But I think the key thing, as to what Bruce said, is the overarching governance. If you have got structures in place, so a key thing there is have a project steering committee that oversees both the infrastructure and the technology component. Otherwise, you end up getting the silos, and the two never actually come together. So I think a key aspect there is ensuring your governance is correct, not just your methodology and your approach, but your overarching governance is correct. That would be my insight. Thanks, Arif.
Thanks, Michael. Giovanni, just very quickly, do you want to add to this, where two teams with two different cultures and this hybrid? There is a question here from Tausif Syed that by allowing them to mix actually could somewhat dilute and maybe affect the effectiveness of agility approaches.
Sure, Arif. So to this, I would say, as project management professionals and as project managers, our goal is to successfully complete the project, meet stakeholder expectations, and focus on delivery, the value delivery, the outcomes, right? Now, I know there is a lot in Agile, and organizations are moving to Agile, and we have hybrid culture. But as far as dilution of agility is concerned, I would say it's scenario-based, situation-based, organization-based. If based upon organization needs, project needs, the work culture, if we need to have some sort of blend, which I have seen in 90% cases, organizations are not typically, depends now. If government, of course, it's like a more on waterfall side, but typically there is a culture of hybrid. So I would say that it's not, we should not take it as a dilution, because we have to focus on delivery and of this project, rather than thinking in the perspective of more on Agile or waterfall. It's a blended thing as well, number one. Number two, PMI has understood the need. PMI has a new certification which is Agile Hybrid Project Pro micro-credential. It's in beta. I recently did it. It enables that hybrid culture so that we don't have a mindset that we are diluting Agile or we are mixing the things. So PMI has segmented it in a very straightforward, clear marginal category. So I think that will help us to practice this in a far advanced and clarified way in future. Thank
you,
you.
Giovanni. Very well put. Okay, so we are nearing the end of the webinar, and I see that the participants also were just about to get warmed up and start firing their questions. But I do want to take this towards, you know, a closing, let's say a closing discussion. And that is also in line with a question that came from one of the attendees, which is, what are the foreseeable new project areas that will come as a result of this complexities or this pandemic in the healthcare industry? And I would like to go one by one now, and I will start with Dr. Bide. From a clinical standpoint, how do the needs of the patient, and now we're talking about vaccination, you know, crowdsourcing and telemedicine, as you have mentioned earlier, how do these change the needs of the patients, and how do companies react to that?
It's very interesting that the way the things have unfolded in the last, I would say, year has somewhat fast-tracked some of the companies in education, or I would say in the digital area, to more than 20 years. It has. So we are living in a place where healthcare industry is, though it's central, but all other industries around it are reacting to that. From my standpoint, there are a few projects that I would say are going to be important and are probably going to be even mandatory. One thing is a project which is directly related to capacity building in healthcare, and that would be around training. Whether there is going to be a global pandemic awareness certification or a certification that blends both clinical and project management part and gives enough opportunity for the capacity of the training around this skill is going to be very important, because as we know, pandemics, this is not the last pandemic. We will see, we just don't know which pandemic that is going to be. The second I would say is, this was a very interesting pandemic in terms of the clinical leadership. So as a physician, we really believe and we depend on some of the clinical leadership that is given by these journal articles and peer-reviewed articles, as in the Lancet. And this time, because nobody just had a clue about, so people were really creating algorithms by the minute. And at one part of the globe, you had an algorithm which was being sent to the other part of the globe. And this whole research around the COVID-19, which would result in newer treatments, would be another bigger project, I would see, because this is not going to be there. That would require very key skill sets, very different skill sets, which would be blend of clinical and non-clinical. So in my opinion, these would be the two main projects. Other than that, obviously, it would be the procurement projects around the key health resources, as the PPE or masks, ventilators, key medications, and the pharma projects by itself is a completely different genre. But these would be the 2 or 3 very important projects.
Thank you so much, Dr. Bide. And Michael, from a PMO standpoint, now that you have the enterprise PMO and you are now doing all range of activities and planning and strategic alignment and responding to the needs of the patients, what is the next step, or what is the next mile for the enterprise PMO in healthcare?
So I think just taking the experience of the pandemic. So when it started, we needed a clinical COVID response at our hospitals. In order to get that done, who was contacted? The EPMO, because we're used to getting things done. What it did entail is a change in our approach and our methodology. So we got the clinical response. as we came through the first wave here in South Africa, the business needed to respond to the impact financially on it. So there was a right sizing exercise. Who got contacted in order to get things done? The EPMO got contacted, and we adapted our approach to address that. Now we're into the vaccination stage, as Dr. Deepa had mentioned. Who got contacted to assist business in terms of the rollout for our healthcare staff? The EPO. So we're always going to be contacted to get things done. What it is that we're going to need to get done in the future, that's definitely going to change. So I see digitalization, technology playing a big role, as had previously mentioned. But then to link onto the change component, our organization has had this opportunity to work from home. It worked for some people, it didn't work for others, but people got used to it. So now we need to change our ways of working, and what we're looking at is a dual workplace arrangement. So maybe 2 days in the office where you can meet with your teams, have that personal interaction, but you still have the comfort and luxury of being able to work from home, not having to commute. A lot of people said it was much more productive. So I think on the human change side, there's going to be a significant focus on change type of projects, not just the traditional putting the box down and making sure that it works and tick everything. So I think that's going to be something exciting, transformation type of projects that we'll be involved with in the future.
Excellent. Thank you very much, Michael. And Bruce, from a technology standpoint, what are the options out there, or maybe not yet out there, right, that we need to look at, that we need to envision and build and start looking into, that would further advance the management of projects in healthcare?
No, very good, very good. I think there's, within healthcare, obviously we've mentioned digitization. That's one of the big thrusts that we have. I think that we as project and program managers definitely have to move into the change management and change maker space. That's key. I think one thing that we're seeing struggling around the world is how organizations and governments are rolling out the vaccine. I recently ran a workshop, and all of us were stymied by the lack of information. So I think there is an opportunity here for people of our skill set to work with large organizations and with governments to help with this sort of society changing. It is both educating and the logistical clinical aspects of rolling out the vaccine. And then thirdly, I think we're going to see a continued miniaturization of devices in the healthcare space. We already see now fairly useful and mobile sonograms and smaller devices for imaging that are going to get to a level where regions within Central Africa or the poor areas of Alabama are going to start to be able to use these types of devices because they're cheaper, and they're going to allow point of care healthcare out at where the patients are. So as project managers, I think we can take our skill set, our background, and what we're good at and help to bring healthcare at a much better space within the world. So thank you, Arif.
Thank you, Bruce. Okay, and Giovanni, I will allow you to close on this competency and skill set. And what do project practitioners, some of the attendees may be graduating soon, some of them may have just started taking a role in projects. What do they need to look out for to develop themselves, and how is the job market looking for healthcare and project management, and maybe what PMI can do to help them? If you can please unmute, Giovanni. Thank you.
Thank you, Arif. So as far as opportunities in healthcare projects, that is concerned, and how can we do better? I would say, domain knowledge and operational knowledge of the organization is very important for delivering successful projects and for new project managers to make an impact and career. Everyone wants to work at the speed of light, right? But most importantly, operational knowledge and emotional intelligence, that becomes the key these days. Dr. Deepa just mentioned about emotional stress, we have in this COVID time, and Michael talked about change management. Bruce mentioned about how can those imaging equipments, in Alabama or South Africa, they will be available. So keeping all these factors in mind, I would say for us to have an impact and for the new project management professionals who are aspiring to be into the project management field, we need to focus on not only tools and technologies, but emotional competence as well. Responding to change over following the plan. To understand who are the opinion makers and leaders, even though they're not carrying the titles in the organizations, that really helps. So project management knowledge, empathy, domain knowledge, and a lot of technologies developing, AI, machine learning. I won't say that we have to be very much technical into it, but knowledge and awareness on how technology is advancing and how can we merge our skill set and learn more and more, to make better, I would say, impact and to add value to the profession, that will be helpful. Adapting to the change is a key skill. PMI provides opportunities for anyone and for everyone who wants to volunteer, and they can upgrade their skill set. Even at South Florida PMI, and I'll wrap this up with that, we have a program for even high school students so that they can get exposure to project management methodologies and they can build their career. So in short, be skilled, have certifications or have practical exposure, join PMI, increase your network, be updated on what's going on in the market, new technologies, be adaptable to change, and last but not the least, be empathetic, have emotional intelligence. So that will definitely help us to succeed. Thank you.
Thank you so much, Giovanni. So everyone, helping and contributing to save people's lives is probably one of the uniqueness of managing projects in the healthcare industry. It is highly regulated, prone to risk, and we really need to understand the stakeholders in healthcare, and that all adds to the complications. We don't know when is the next pandemic going to be, but we do need to continue building preparedness and readiness, as was explained by Dr. Bide. There is still a long way to go for us to really be responsive and adaptive to pandemics. The challenges, of course, is the retraining of the staff, competency building. Do we build it in-house? Do we get it from outside? We have to improve our stakeholders management with the government and the medical practitioners. Digitization is also something that has come up a few times in the discussions. And a key also element of managing projects in healthcare is our ability to manage changes. And this is going to be a big focus in the near future, right? But being efficient and finding that balance between predictive with the more structured delivery and agility to always adapt to change, I think is going to be key as well. So I would like to thank all our fantastic speakers today who have dedicated their time to share their knowledge and experience, hands-on experience. I hope that the session has been informative, and I hope that you all enjoyed the session as much as we enjoyed the discussion. Thank you so much, and I'll hand it back to Priya.
Yeah. And I will hand it over to Vrushank for thanking everyone and closing the session.
Sure, thank you, Priya. Insightful session, definitely from a learning perspective. It is difficult to summarize these points, but I would like to recap a few points that inspired me. Like Giovanni nicely explained various different areas or sectors in healthcare and how everyone shared a common goal so important, that is saving human lives. Deepa provided a medical practitioner's perspective, the work effort involved, and how the health institutions responded to this pandemic. Michael brought out stakeholders' perspective, the requirement to develop new skills in order to manage the situation, project portfolios, and importance of governance in relief. Bruce elaborated about mixing multiple project management methodologies for healthcare projects involving simultaneous tasks related to infrastructure and software development. And Arif said we don't know when the new pandemic is going to come, but we all know our next panel discussion is scheduled next month. So I sincerely thank the panelists, Deepa, Shivani, Bruce, and Michael, for sharing their thoughts and experience with us. A sincere appreciation from all of us at PMI Chapter Exchange. May I request all participants to share their valuable feedback on the link. Yeah, that's it. And if Pierre, can you just add the link in the chat session?
I've done that.
Yeah, thanks, Pierre. Please think and add the topics you would like to hear on this. And I take this opportunity to thank Swati and Sunil as well, our WebEx admins, for making this event smooth as always and distraction free. Also Damike for wonderful flyers and being our social media champion, spearhead this event. And PDF codes will be displayed on the screen. I think it's already displayed. Yeah, just please claim this PDF code at your first opportunity. Thank you. Yeah, over to you, Priya.
All right, so that's all from my side as well. Thank you everyone for joining the session, and we hope to see you again next month with another interesting topic, another diverse set of panelists, and see you then. And watch this space for more. And thank you everyone for joining in, and see you. Bye-bye.
Thank you very much, everyone. Priya, Mumbai chapter, all panelists, all participants. Thanks again.
Thank you.
Thank you, everyone. Bye.
Thank you.
Thanks.
Thank you. Bye.